Note: all of the information is current as of April 5th, 2020. This is a fast-moving situation, so things may have changed by the time you watch this video. So let's say there was a global pandemic. And let's say you were trying to contain the outbreak on an island in the middle of the Atlantic. How would you go about it? Would you try to quarantine everyone? Would you try to stop all flights? As of April 7th, 2020, the World Health Organization has confirmed over 1,200,000 cases of COVID-19 in 207 countries and territories. This includes over 72,000 humans who have lost their life due to the complications from this disease. With quarantine now reaching over 2 billion people on Earth, this pandemic is continuing to burn through countries across the world. But what if you're an island? Last time, we discussed how the Faroe Islands adapted a salmon virus testing system and used contact tracing to keep COVID-19 under control in a population of 52,000. Now, what if your population is bigger? With a population of about 364,000, Iceland has been covered in American and British news in the past few weeks due to their coronavirus response. Where countries like the United States and the United Kingdom were playing catch-up, Iceland responded quickly and got ahead of the pandemic. Again, as a side note, I love the flag and coat of arms. I mean, come on. The coat of arms has a bull, a giant, a griffin, and a dragon, and they're standing on top of a block of lava stone. That's some serious don't try me vibes. As of April 5th, Iceland has recorded 1,586 infections, with 39 hospitalized, 13 in intensive care, and 6 deaths. They've also been able to do extensive testing, usually processing over 1,000 samples a day since March 15th. In total, they've processed 28,992 samples. This translates to about 81 tests per 1,000 people, or 8.1% of their population. In comparison, Italy has tested about 1.1%, the United States about 0.5%, and the UK about 0.2%. Iceland has a unique partner in the fight against COVID-19. Decode Genetics is a biopharmaceutical company based in Iceland. Founded in 1996 by Carl Stephenson, their testing has made up well over half of the daily samples collected in Iceland. Decode was originally created to find genetic risk factors within a large set of data. The relative homogeneity of Iceland's population worked well for this. They've gathered genotypic and medical data from over 160,000 people, which is over half of the adult population of Iceland. In the COVID-19 pandemic, Decode specifically accepts people who are not showing symptoms and are not in quarantine. What they found is that while fewer than 1% of the tests came back positive, 50% of those who tested positive were asymptomatic. Additionally, 54% of those diagnosed were already in quarantine. Crucially, Iceland has used these results to focus on quarantine and containment. While they have put in social distancing measures similar to other countries, they've been able to treat patients early and accomplish contact tracing to test others who might be ill. This has also affected their deaths per million people, which is just over 11 per million, compared to Italy at 254 deaths per million, the United States at 26 deaths per million, and the UK at 64 deaths per million. The difference comes from being able to detect cases early, even in those with few initial symptoms. Iceland has been able to avoid strict isolation procedures because of testing, quarantine, and contact tracing. They began their testing process in February, well before their first confirmed case. The mass testing in Iceland, especially of asymptomatic individuals, isn't likely to be possible in larger countries, especially at this point in the pandemic. What it can provide is a microcosm to study the SARS-CoV-2 virus. Decode Genetics have already been able to detect specific strains, including 3 main clusters. This means they can actually track where the virus came from in specific cases. Some from a group that was vacationing in the Alps, some from Italy, and some from a group who attended an English soccer match. The World Health Organization has said the most effective way to combat COVID-19 is with information, and with that, we need to test. With a disease that is so dangerous yet can be hidden in carriers, the lack of wide-scale testing is keeping countries' efforts from being as effective as possible. They've had to rely on large-scale measures, such as complete shutdowns, because they were not prepared with testing equipment and lab capacity. Decode Genetics is now calling up people randomly from the telephone directory and asking them to test. While not a true random sample, the findings will be able to give us a better idea of what the actual prevalence is in the population. Iceland is a unique nation that has used their resources to effectively not only handle the pandemic, but also add to our global knowledge base in fighting the disease.